Good afternoon, everyone. I want to give a minute or two to allow people to join on to the Facebook Live conversation. My name is Jamal C. Boyd Sr., and I'm the CEO of the Crossroads Center. And today I wanted to take an opportunity to provide both our internal audience as well as our external audience with an update as to where we are as an agency on the coronavirus COVID-19 pandemic. And many of the behavioral health, mental health, addiction treatment service centers or recovery providers are in a space of uncommon or uncharted territory. None of us have experienced such a challenge as what we are up against as agencies that are providing the great care and resources to our patients and clients that we provide on a day-to-day basis. We have not experienced a challenge such as this. So as the leader of our agency and on behalf of our agency and our board and our mission, I wanted to have a conversation with the public about where we are, what we're doing, and how we need to work together to overcome the challenges that we're facing in terms of the provision of the care that we provide day in and day out without disruption. So with that, I want to pause for a second and give about maybe 60 seconds for individuals to join into the Facebook Live conversation and then move forward. So I'll take a quick break and then we'll go into the purpose and intent of today's update. So again, good afternoon, everyone. My name is Jamal C. Boyd Sr., and I'm the Chief Executive Officer for the Crossroads Center. We have been in business since 1951 doing the work of the community, serving the community under our mission. We started out as an alcohol and drug and alcohol program under the auspices of the University of Cincinnati. And we then stepped out of that relationship and became an independent agency providing drug and alcohol treatment services to the community. And over time expanded those services to not just drug and alcohol services, but also addiction treatment services, mental and behavioral health services as well. And as an established 501c3, we were able to expand the level of care of what we do and have been doing in the community since that time. So we're an agency that's almost 70 years old, and we are also an agency that have been providing expansive services in Hamilton County region, but around the state as well in other areas where our clients come to us from all over the state of Ohio, and we are able to, through our capabilities, provide care in those areas around substance abuse, mental health, and addiction treatment services. So we are very excited to be an agency that has been a pillar in the community, as well as a service provider that clients, patients, and our consumers depend on for the care that we provide. And with that said, during this time that is more challenging for us as a community and as a world in dealing with the coronavirus COVID-19 pandemic, I want to assure the community that we are here, we are strong, and we continue to be available to our clients and our patients and our consumers, as well as our staff and team members who serve the mission of our agency day in and out with excellence and with top priority and high quality. With that said, we are an opioid treatment provider, or an OTP, and we are not able to close or shut down in terms of the services that we provide. So the first point that I wanted to share with all of you is that we will not be closed during the crisis. We are open, we are available, but yet we have modified some of what we are doing to ensure that we are, one, following the guidance that has been given to us to follow from both the federal and state government entities and leadership, as well as our local leadership through our local health departments and mayor's offices and other regulatory agencies that we are partnering with to manage through this process. And our availability in terms of our access, we are open, we are available, and you can reach us the same ways that you have been contacting us. You can also visit our website for updates in terms of any changes or modifications to the services that we provide to get additional information. And we can, what I will do is have my assistant post the website information as well as our telephone contact number in the thread that you can read as we go through. Additionally, the other piece of knowledge I want to share is for our team members and our staff. We have not laid anyone off. We are financially solvent. We are a strong organization in terms of our financial responsibility, but we are daily monitoring the expenses and the impact of what the coronavirus pandemic has placed on our agency. Our operations continue to be modified in terms of our services and our programs. Our intake process remains intact. We will, through our residential program, continue to take on clients. And I encourage our partners in the homeless community and other communities that if you have clients or patients that need our services, please refer them to us, because we do have capacity. We will maintain capacity, and we will provide the service and care that we are allowed to provide and care during this time as we look at maintaining the health and the public safety of our community. One of the things that I wanted to make sure that the community is aware of is, one, our programs and services. So we pretty much function in three key areas. One is outpatient. The second is our residential programs that we have, which are two of those. And those are our women's program, which is our Cheney Allen residential program, where we house up to 16 women in that program. And we have capacity to, again, take on additional patients and clients in that area, in that programmatic area. And we also have our adult residential care program, which is our ARC program, and that is co-ed, and we do have capacity, again, to take on additional clients there and patients in that program so that we can serve your needs as well as the needs of the community during this very tumultuous time. And then we also have our medication-assisted treatment program, which provides methadone and dosing services to the community that we touch. And we've made some modifications there to accommodate some of the restrictions and the regulations that have been placed on the community so that we can limit as much contact that we have with clients directly through that program area. And we've adjusted our schedule, and we've also adjusted the way that we provide dosing for those clients that are also eligible to take on a 14-day supply of dosing at home. We have modified our dosing methods so that we can accommodate the requirements for social distancing, as well as for some of the restrictions around managing the spread of the virus. And what we've done, the impact that has had on us from an operational perspective is that it has allowed us to reduce our contact with clients to the degree of 60%. We know that this is a new way of doing things, but we have thankfully gotten the cooperation of both our clients, our patients, and our team members to adjust to the new way of doing what we need to do to first manage the public safety crisis that we have, limit our interactions with individuals that we are coming in contact with so that we don't further exacerbate the spread of the virus or provide any opportunity for us to mismanage this time. So in our programmatic areas, we've made some adjustments, again, to adhere to the regulatory concerns and constraints that we have been placed under, adhere to the recent stay-at-home order that was implemented as of 11:59 p.m. on March 23rd, which was yesterday, as well as to make the shift to an essential staffing only workforce plan that we have implemented as a result of adjusting to what the new way of doing business has caused us to do. With those adjustments, again, I want to assure our clients, our patients, our community, as well as our consumers, vendors, and staff and team members, and our larger public community that, again, the Crossroads Center is a resource that remains intact and in place and available during this time, as well as our services will continue to be delivered with excellence and with quality and with the highest standard of care during this time. We have also shifted to providing our direct contact services as much as possible to telehealth and telemedicine. And we are thankful to our leadership around the state and around the country for working on ensuring that we have alternative methods to provide care that also allows us to provide a continuum of care without having to have direct contact. So we're thankful to be able to provide those services and resources without interruption or without disruption, but in a different way. And we are implementing those techniques and providing the technology for our team members and staff and our clinicians to be able to do that from either on site or remotely to ensure that our clients who have a dire need for the services that we provide have no disruption. And let me say something quickly about the clients that we treat and patients that we care for. When most of our clients and patients come to us for care, we are not just receiving them for the services that we provide from a substance use disorder perspective, from an addiction treatment services perspective, or from a mental or behavioral health perspective. Those issues compound what we receive in terms of the care that we need to provide to the clients that come in our doors. They also bring their health conditions, chronic health conditions, or other health related matters that most of the other health systems and hospitals do not entertain to the degree that we do. So it's important that we have the correct resources as well as the right relationships internally as well as externally with other care providers to ensure that whatever they get from us is complete and comprehensive, but that we also have the support outside of our agency for what's going on. And this coronavirus COVID-19 crisis and pandemic has put an extra heightened sensitivity on our ability to make sure that we're giving clients what they need so that they maintain not just their sobriety and also their ability to stay on course with their road to recovery, but all of the other subsequent resources that they may need after they leave our facility. So it's critically important that we understand the complexity of the clients and patients that we care and treat for, but that we also set them up for success once they leave our facility. And what I believe that this crisis is doing for us is teaching us as leaders, it's teaching us as agencies, it's teaching us as the healthcare industry how to play better in the sandbox, if you will, for lack of better terms, with those who also touch the patients and clients that we care and treat for, but to also do what we are doing differently as we come out of this crisis. And I'll try to summarize and talk a little bit about that in more detail as I come to a close on our update today. Secondly, I wanted to address our services and what we're doing, again, from an outpatient, from an inpatient or residential perspective, as well as from a medication-assisted treatment perspective. We are, again, ensuring that our services are not disrupted through what we are providing during this crisis and during this pandemic. For our outpatient and all of our programmatic areas, we are and have implemented a screening process to evaluate both our patients and clients, our team members, and anyone that are coming through the doors of our agency to ensure that we are compliant with the temperature checks and to make sure that if any one of us in that list that I've listed or mentioned earlier are symptomatic of anything that may compromise the health and safety of the environment in which we provide care. We are asking clients and residents and patients and team members to first do a self-evaluation for the most part if you're able to do that. And if you identify before leaving home that you are having a temperature at the very minimum of 100.4, we're asking that you either stay home, contact us if you have questions, or contact your healthcare provider to get additional information on how you should proceed with either continuing to keep your appointment or making your time with us or coming into work, or either canceling that, rescheduling it for another time when you are more healthy and don't have any of those indicators, as well as for our team members encouraging you to stay home if you have at least identified that, because when you do get into the facility, you will be screened and checked again. And if you fall within those categories of those which we have to remove you from the facility or ask that you go home, we want to save you that challenge, particularly now during the stay-at-home order that has been enforced. As you're coming out as essential team members and as you're coming out as clients that have an essential need to seek care, you are allowed to leave home for those purposes, but we want to make sure that from an agency perspective, we're all doing our self-regulation first. And then secondly, beyond the self-regulation, you will be screened as an agency requirement on all fronts before us being able to provide to you that excellent care that I mentioned earlier. So we wanted people to be prepared for that, regardless of where you are in the need for services. And if you do have an emergent need or emergency need, we again advise you to give us a call so that we can evaluate that. We have doctors on call at all times to be able to respond to your need or inquiry. And we have availed ourselves to ensure that we are providing excellent care around the clock, particularly during this crisis. But this is nothing indifferent than what we already do as an agency to provide that standard of excellence in care. Also around our services, just want to reiterate that what we do as an agency, we're not doing anything different. We have put an additional emphasis on some of the things that we have done to keep our environment safe, healthy, and practical for all of our patients, clients, as well as our consumers and our team members. But we've been more vigilant around the things that we do and are encouraging our audiences that we touch to do the same. So hand washing, ensuring that we're wiping down surfaces to keep a clean and a safe and a healthy environment for everyone that are coming into our facilities, so that, again, we are not compromising the care or the quality or communicating any bacteria or diseases during the time where we have to have a heightened awareness and a heightened response around the things that we are doing to provide care. As a result of our methadone dosing clinic and our medication-assisted treatment program, we have modified our schedule so that, again, we can limit the number of clients that we have coming in for that service on a daily basis. We treat and dose in north of 500 clients and patients a day through our methadone dosing clinic. So with our adjustments to our schedule, and we've modified that to adhere to a Monday, Wednesday, Friday reduced schedule, and scheduling via appointments and whatever other methods we can do to modify that, as well as a Tuesday, Thursday, Saturday schedule to accommodate the same, so that we can manage our crowd and manage our intake and manage our interactions with the individuals that are coming in for dosing, so that we can limit the exposure and limit the opportunities for us to come in contact with anyone that may have the coronavirus but may be asymptomatic. So with that management, as I mentioned earlier in the broadcast, is that we were able to reduce our interactions with clients by 60%. And we've also implemented a dosing strategy where those clients who are eligible and able to do so, we provided and are providing those patients' clients with a 14-day supply of take-home dosing. And we're also looking at other strategies for being able to accommodate, again, those who are at risk and those who meet the age requirements of not being able to come in contact with the public so that we keep them safe, so that they do not miss their dosing, as well as not miss the services that we are able to provide. In terms of our team members, I just wanted to take a moment to talk about our essential, non-essential workforce development plan and strategy that went into place yesterday. One of the things that we are very keenly aware of is that this is a stressful time. And one of my mottos as the leader of my agency is to always take care of the people who take care of the people. And as a result of that, our strategy is to ensure that we are first doing the best thing to keep all of our team members whole during this time. And, whatever the financial investment is to do that, whatever resources we're able to commandeer through the state or through the federal government, and I am imploring and advocating for the rainy day fund to be opened up. Governor DeWine and all of the leaders who have the ability to make that decision. If there is not a time when it's raining, it's now. And as a nonprofit who is doing the good work of the mission that we execute every day, every resource that can be allocated to recovery provider agencies is needed now. And we want to try and make sure that we are not forcing us into a position as an agency where we have to be concerned about our financial solvency in months to come. We're looking at these things daily, and we're looking at these things and making projections and analysis to ensure that we don't have to tap into reserves, or we don't have to modify our budget that we've laid out for the year based on where we are. But I want to assure every Crossroads team member that you have nothing to worry about relative to your job, because your leadership and your leaders have looked at what we need to look at to ensure that we not only try to make sure that you're whole during this time, but that you have resources like your PTO bank, as well as other resources that are available through state and local government, either stimulus and or other resources that are being made available as the federal government and the president and the state are looking at what resources they can provide to us. We are working daily to ensure that that impact does not impact you. And you have my commitment, you have our commitment that we are going to do everything that we can to ensure that you're kept whole during this time. And the reason why we share that publicly is because I want to also encourage my fellow CEOs and leaders of other not-for-profit agencies that are going through some of the same challenges to try and do what's best to ensure that we can accommodate the health, wealth, and welfare and well-being of our team members. To our team members, I implore you to take advantage of the employee assistance programs that we put in place for you to use during times like this as well. There's a wealth of resources that are available by tapping into those services, and we encourage you to do that not just from an employee assistance perspective, but from a mental health perspective, because managing through this time keeps you able to provide the services as essential team members to the clients that depend on you to show up with excellence. And we are, as a leadership, trying to ensure that we provide every opportunity for you to show up with excellence by giving you the resources that you need to be successful. That is my commitment. That is your executive team's commitment. That is the board's commitment to you, so that we can ensure that every day that we are asking you to put your life on the line to come in and serve the mission of this organization. We want to make sure that you are equipped to do that with excellence and have everything that you need to be successful. Ultimately, our goal is to ensure the safety, the security, and the stability and sobriety of all of our clients, patients, consumers, vendors, and even our team members and our agency that we come in contact with, in the larger community that we come in contact with. And we are very excited to, one, be available still during this crisis. And we will make every conscious decision to remain available, remain financially solvent, and remain the agency of choice when it comes to the services that we provide as much as we can to the community. And I am excited and humbled to be leading the efforts of our agency during such a tough time. Because what I believe is occurring as a result of this crisis and this pandemic is that all of us are being tested right now. Our agencies are being tested as to whether or not we are capable of delivering what we need to deliver, not just when times are good, but in tough times like now. We are also being tested around our policies and our ability to deliver the mission of our agencies on a daily and consistent basis without disruption. And it is exposing us as leaders, it is exposing our policies, and it's challenging us to close gaps and identify new policies that need to be created. And it's also challenging us as individuals about our commitment to the missions that we say we serve. And I, again, am more than humbled and honored to be leading during such a time like this, because I think that it's going to challenge me as a leader, but our agency around our mission and how we go forward from here. And in closing, what I'll say is that I believe that we need not come out of this coronavirus COVID-19 pandemic looking to return to how we did this previously or the way we've done it before. I think that we need to, from an industry perspective, from an agency perspective first, but from an industry perspective second, and from an interdisciplinary, interagency perspective, come together to determine how we do this differently and develop a new norm so that when the next crisis hits us, we're not reacting the same way that we are right now, and that we're better prepared to deal with this. So whatever resources that we can pull together and leverage as partners in this, we need to come together and do that. What we also need to do is make sure that the relationships that are being fostered and forced to be developed right now, that we work on maintaining those relationships post-pandemic. We also look at what we have the opportunity to create is by looking at the failures and faults that are necessary for us to be able to fix. It is important that we work together to ensure that we come up with a demonstrative plan that will be implemented that allows all of us to come together the same way that we're coming together right now, from a federal perspective, from a state perspective, from a county and local municipality perspective, to ensure that what we are providing in terms of our continuum of care continues to have the impact on every individual the way that it does, and that everyone is able to be successful. No one should be suffering during this time. No one should be failing during this time, and no one should feel as though that they are any less than any of us as we go through this and as we go through this together. We as a Crossroads Center, as I said, are available. And as an executive team, as a leadership team, our board members and our team members are committed to serving the mission of our agency and serving the community that we touch. And if there's anything that we can do to help during this time, not just with our patients and clients that we touch, but with other agencies that are in the behavioral health, mental health space, and or local state government, whatever we can do to be available to provide our service, because we are here to serve. During this time, please do not hesitate to reach out to us. At this time, I would like to pause and see if there are any questions that I might entertain from the audience that is watching. And if there are any questions, my assistant is on the line to document those so that I can see those. I will respond to them. But if not, we will conclude our Facebook Live message, and this will be posted on our page for you to view at another time. And if you do have questions post our getting off of the Facebook Live, please feel free to share them. We are responsive on social media, and we will get back to you. But again, we pray that each and every individual is healthy and safe. And if there's services that you need that the agency provides, please do not hesitate to reach out to us, because we do not want anyone out there struggling with substance use disorder, addiction, services that you may need to come in contact with, mental or behavioral health challenges or issues on your own. We are here for you. We want to serve you, and we want to make sure that you are safe, secure, and sober. And with that, God bless you and thank you. Are there any questions? Okay, haven't seen no questions come in or any notifications about that. Have a great rest of your day. Please visit our website. We have a coronavirus COVID-19 page that you can click on the link from our homepage of our website, and it will take you to the most recent up-to-date information that we have been given from our website, as well as any updates regarding the agency. Or if you have any direct questions, feel free to give us a call at 513-475-5300. And again, thank you for supporting the Crossroads Center, and thank you for your time today. Be blessed. Thank you.